All right, good afternoon, everyone. So welcome to Heart Health Month. I'm Sean Rees, and we're going to spend the next maybe 20 minutes, 25 minutes or so talking about some heart health stuff, some diet stuff, some hypertension, some stroke, some cardiac things, and then certainly at the end have time for you guys to ask any questions that you may have. So this is who I am, Sean Rees, followed by a bunch of fancy letters and some numbers and an address and all kinds of things. But what I really want you to do, everyone get your cell phones out and your smartphones, is this. This is what you need. You need my name and my phone number. This is the direct line to the emergency department. And so if you have a question, feel free to call if I'm working and if I'm awake. I'm more than happy to talk to you guys about whatever questions you might have. But that's sort of what I do. Who I am is a father of 3 girls, very proudly so, who are super, super bright. The middle one's super, super sarcastic. Those of you in the audience, don't say, I know where she got that from. And also certainly a proud father, and a husband. Just got married 6 months ago, 7 months ago. So what are we going to talk about today? Some basic diet concepts. It's going to be, all of these things are going to be fairly basic because you could spend an hour talking about any one of these. But I wanted to kind of hit on some high points of them. So some basic diet concepts. So a lot of this stuff centers on doing things in moderation. So eating in moderation. When your body tells you that you're hungry, maybe you should probably stop eating. And eating more, it's just going to add calories and contribute to that and your weight gains. And so if your body tells you that you're hungry, you should probably listen to your body. Eat sensibly. We'll go over some of these things. Watch for carbohydrates, for fats, hidden sugars in things that you don't really know are there. Try to eat heart healthy foods, things like fruits and vegetables, lean meats, fish. Don't be afraid to read the labels. We'll go over the labels in a second that come on many things, not all things, but many things that they're supposed to come on. And then certainly if you have special dietary restrictions or things, follow what your doctor or dietitian may be telling you to do. Drink lots of water, please. The recommendation, 8 to 10 glasses of water, 8 ounces of water, 8 to 10 glasses of water a day. One thing to remember also is to try to drink before you begin to eat some water. It just kind of fills your stomach up a little bit and gives your body a sense that it's sort of already a little bit full, and so that can help you decrease the amount of food you eat, and can help with that. Drink alcohol if you do so in moderation. I don't have a lot of visual aids, but I have one. So that's an 8-ounce glass of red wine. So this is 8 ounces. Wine glasses are shaped like this for special reasons for red wine. They're not meant to be filled to the top. And so that's a glass of wine, one a day. That's how big it is. So obviously you can have 2, but just keep in mind that a glass of wine is not filled to the top. And then avoid eating late, in the evening. So if it's 10 o'clock and you want a midnight snack and you have 2 pieces of pizza and go to bed, you're not burning those calories unless you're sleepwalking 6 miles. So be careful and be cautious about that. You can stop eating ideally after dinner, 6 o'clock, 7 o'clock if you're late, but not eating 8, 9, 10, 11 o'clock at night because you're not going to have a chance to burn off any of those calories. So just please keep that in mind. Here's a label I was talking about. And so the numbers up there, 1 serving size. You can be surprised when a bottle of juice, and you say, oh, there's a bottle of juice, I'll drink that. And then you look at the bottle and it's 3 servings. And so what all those numbers on there, you can multiply them by 3. You can multiply the calories by 3, the carbohydrates by 3, all those things. That's where it sort of comes into the servings per container. And then keep an eye on the total carbohydrates. Most of those over here are going to be sugars. There's some fiber in it, but almost all of it's sugars. And then also be aware of things where there's added sugars. And try to avoid things that have added sugars. And number 4 is showing you to kind of try to focus on things that have high in fiber, high in vitamins and minerals, low in sodium, which is up here, and it's separated out for that reason. And certainly choose things that have lower calories, lower fat contents. Look for the hidden sugars. and the added sugars, and then certainly avoid trans fats. A lot of the fats now it's really actually hard to find things with trans fats in them because so many manufacturers and things have been taking those out because they know how deleterious they are to people's diets and to people's health. So just a little bit about some sugar. So here's just a sort of like the hidden sugar kind of idea. So 1 8-ounce glass of orange juice is the same as 3 oranges. Obviously you can tell there's 4 oranges there, but for the photo, just think of it as 3. Most people don't sit down and eat 3 oranges at a time, but they'll certainly drink 8 ounces or more of orange juice. And so the calories from that just build up very quickly, and it's easy to get the sugars from that. Granted, the sugars from a fruit, but you can easily, the FDA, allowance for fruits is 3 to 5 servings a day. So 8 ounces of orange juice, you already have your servings of fruit for the day. You drink more than that, you're going to get higher sugar contents and things. So just be aware of how many things can be hidden in juices and other things. The same thing would go for dried fruits. You can sit down with a little bag of apricots and pop them in your mouth while you're watching TV or something, and all of a sudden you realize you've eaten 18 apricots. No one's going to eat 18 apricots, but they can certainly down 18 dried apricots pretty easily. And just keep in mind again, what that might mean to your overall calories, overall sugar content, and in general overall health. So a little bit about salt. So obviously those are Doritos. I have no stock in Doritos or anything like that, conflicts of interest for Doritos. But it's just an example. So 1 chip is 20 milligrams of sodium. A small bag of Doritos has about 11 chips in it, so that's 220 milligrams of sodium. The large party size bags has almost 4 grams of sodium in it. Certainly, that kind of depends on how big your party is. If you have a party of 2 watching the Super Bowl, that's almost 2,000 milligrams of sodium for each of you. The average American, you can see, eats about 3.4 grams of sodium when the goal is 2,000 or less. I'm sorry, you use 2,200 or less, which is about a teaspoon. This is what a teaspoon looks like. That's not a ton of salt. You can see there compared to the size of a penny on a plate. It adds up quickly, and those hidden amounts of sodium that you can see on those labels, they add up, and they add up very fast. So just keep that in mind. Everybody loves donuts, at least most people do. I shouldn't say everybody, but donuts. And again, sort of a source of sugar, a source of fat, almost no other real nutritional value. Now, the closest one that I found as far as Krispy Kreme, there's other donuts available, but Krispy Kreme I think is in Missoula, is the closest I found. So it's kind of hard to have Krispy Kremes on hand or to go and get them. But I have an alternative for you. Here you go. Take some tats of butter, coat them in a little bit of powdered sugar, and you have the exact same calories you're going to have in a single donut. So each donut that I showed you has the equivalent of 1 pat of butter, and then obviously some sugar. So there's no daily allowance of donuts, but just keep in mind how those can add up. They're kind of like potato chips. Sometimes it's hard to just eat one, and just like with the potato chips, the calories and the sugars and the fats can add up very, 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 very quickly. I want to go through these kind of briefly. And you guys have all seen these in the past, sort of the pyramids for foods. Started out with kind of at the top. Oopsie, sorry, I went too fast. At the top, the minimizing oils and fats. Again, there's certain types of oils that are healthy, like olive oil, extra virgin olive oil, versus lard or butter. So not everything is the same. Just like in the meat category, chicken or fish isn't the same as a nicely marbled New York strip steak. So again, proteins aren't all the same. Fruits and vegetables. And then this is from 1992 to 2005 before they changed it a little bit. Down here on the bottom, they kind of lump breads and cereals and rice and pastas. It's hard to read, but that's 6 to 11 servings in a day. None of your doctors, none of your dietitians are going to recommend 7 servings of pasta a day. And so that's why they realize some of these things and some of the idea is good to help you kind of focus on things, but they changed it in 2005 to 2011 and made it less of a stacked pyramid and more things side by side, each color representing different things. So there's the grains, the vegetables, fruits. This yellow line isn't even represented down here, but that's kind of the fats, dairy things, meats and beans. And again, it doesn't really help tease out which meats, which fruits, which vegetables, and stuff like that. So they changed it again in 2011, and this one I find kind of helpful. So this is on choosemyplate.gov, and it kind of breaks things down, and you can see the vegetables are a larger portion, grains are a larger portion, protein, fruits. Dairy is almost sort of a side dish type of thing if you want a little bit of yogurt. And again, things like yogurt, not all yogurts are created equal. You get a non-fat Greek yogurt versus something that has added sugars, fruits inside of it, and those types of things. Again, sort of those hidden calories that can build up, and just keep an eye on. So this is just another way of thinking about it, and I think a little bit more easy way to think about it, and a little bit more educational way to think about it, as far as how your eating habits go and how your breakdown of your meals is concerned. So exercise, the quick answer is yes. Everybody, is whatever you can do. Again, so you don't have to join the gym to exercise. You certainly can, and it's fantastic if you're able to, but it's not a requirement. You can do some of the things that are listed up here, like if you're at home when you're loading and unloading the dishwasher or the dryer, instead of bending over at your back, which uses almost no muscles, squat down and get the things out of the dryer, squat down and get the things out of the cupboards or cabinets. And you can, over time, those little things are going to add up, especially if you do them with all your activities during the day. You can do that. You can do, I have wall/counter push-ups, so sometimes it's hard for people to get all the way down and do a regular push-up. But if you stand in the kitchen, you can do a push-up against the counter, or you can do a push-up against the wall and just stand far enough back that you're actually leaning into the wall and pushing out. Again, these are little things that over the course of the day can add up and can make a difference over time. Walking stairs, if you have them in your office building or in your home, and maybe walking them more often than you need to. Instead of taking one trip with a bunch of things, maybe take 2 trips up the stairs. And just be creative in ways you can do that, like parking further away from your office, parking further away from the grocery store, just making that extra effort to walk a little bit farther and to burn a few extra calories. And the whole point is that all these little things are going to add up over the course of the day and are going to be beneficial over the course of your life. Again, sort of exercising with family and friends is up there to just remind you that you have ways that can kind of make you accountable. It's like if your friend wants to exercise and you go with them, you're kind of accountable for doing that. Also gives you some motivation to do those types of things that you may not otherwise do by yourself. It's like, oh, I don't feel like going today. But if it's like, well, I'm going to meet my best friend, so I'm definitely going to go today, that can add motivation when you might otherwise not have it. And again, doing things in moderation to start with is much better than not doing anything at all. So little things like I talked about, just the squatting at home, the push-ups at home, walking farther to the grocery store. It may not seem like a lot, but it adds up over time, and it's better than staying at home and deciding I don't want to go out today at all. So as far as monitoring your weight, yeah, we'll get to the scale thing in a second, but you can also just use more simple things like how do your clothes fit? It's like, wow, I used to be able to button these a month ago and now I can't button them. Or when you look in the mirror, it's like, things seem to be a little bit heavier than I was before. And so you can use things that aren't necessarily a scale. Obviously, there's all kinds of scales that measure your percent body fat and all kinds of things. Even a basic scale is fine. I think the point is that you can certainly use a scale, but let it help you take control of your life and help you control the things as far as your eating and exercise, rather than it controlling your life. And so just try to keep that in mind. I think that would be helpful. There's a BMI, which stands for Body Mass Index. It's a complicated calculation of essentially your height and your weight, and it gives you a number. and it's used, some health companies use it, insurance companies use it. But so for an example, here's mine. I'm 5 feet 7 inches, I'm 180 pounds, so I'm overweight. In fact, I'm close to being obese based on that. And so it's another thing, it's like, okay, don't take every number you see or hear as dogma that you are overweight, that you are obese, that certainly I can be healthy, I can watch what I eat, I can do those things, but my doctor, Aunt Healy, would probably tell me to get to, I'd have to lose 20 pounds. That's probably the equivalent of cutting off both of my arms, to get to a healthy BMI. For me to lose 20 pounds would be challenging. And for a lot of people it would be challenging. And so just use it as a tool to help you kind of guide your lifestyle and the things that you do, rather than it controlling what you do. So kind of another example of that. Just talk a little bit about high blood pressure. So they changed the definitions, and I have a slide to go over that in a second. But now it's less than 120 over 80, i.e. 119 over 79. That's considered normal or below that. In the old numbers, 120 over 80 was considered sort of normal. But now officially, based on the new AHA guidelines, that's the American Heart Association, 125 over 85 is hypertension. Control these things, your high blood pressure, as best you can by the things we've talked about, which is watching your diet, exercising, being cognizant of what you eat and what you do. Then, certainly in conjunction with your primary care physician or your doctor, if you need to add a medication, fine, do that. If you try these other things first and they're not working and you want to get your blood pressure down, monitoring your blood pressure is certainly worthwhile doing, again, using it as a tool to kind of help see where you are, not becoming wedded to it. Certainly in the emergency department, we see people who take their blood pressure 5 times a day, 6 times a day. And if it's a little bit elevated the first time, I can almost guarantee you it's going to be a little bit more elevated the second time you take it, because you're worried that it was elevated the first time. And it can just kind of build on that and become a nasty spiral. So talk to your doctor, talk about when you should take it, what time of the day you should take it, how often you should take it, and again, use it as a tool in your toolbox to help guide your health and help you decide, okay, I need to be more cognizant of how much salt I'm ingesting and eating, how much fat I'm eating, how much exercise I'm getting. As far as when to seek expert consultation from your doctor or from the emergency department, there's not a specific number. There will be a number on the slide I show you in a second, but it's more what symptoms you have because of that elevated blood pressure. If you're having chest pain, if you're having difficulty breathing, if you're having a horrific headache that you normally don't get and your blood pressure's high, that's super concerning and you should be calling your doctor or coming to the emergency department for that. But if you feel fantastic and your blood pressure's 160 over 90, call your doctor and say, hey, my blood pressure's up today, what should I do about it? Can you see me in the office? And so it's not necessarily, I can't give you a specific number that if it's exactly this number or higher, you have to come to the emergency department. You're always welcome to, and we're welcome to look at it and see what might be wrong, but it's more of what that elevated blood pressure might be doing to how you're feeling or a symptom that you might have, rather than the specific number itself. Here's what I was talking about. So now from the American Heart Association, the blood pressure, I apologize. The blood pressure category, so normal is less than 120 and less than 80. So like I said, 119 over 79 kind of thing. Now you're officially elevated if you're above 120 to 129 and still less than 80. And then it starts to get into different stages, stage 1, stage 2, which aren't really so important right now, but you can just see that the numbers change. The number at the bottom is what they call a hypertensive crisis. And it's essentially saying that if your blood pressure is greater than 180 with the top number, or greater than 120 with the bottom number, that's the reason you should be consulting your physician or coming to the emergency department and deciding what we need to do to help bring that down, whether it's something urgently in the emergency department with an IV medication, or whether it's changing the regimen of pills that your doctor has you on to help lower that. What are the importance of having regular doctor visits? They're severalfold, as you can see. One, it allows you to create a relationship with your doctor so that they know you and you know them and you're comfortable talking with them about your healthcare needs. It allows your doctor to keep track of your health and monitor trends over time, and they can see like, oh, you want to let you know your blood pressure is creeping up. We check your cholesterol and it is creeping up. And so they can't really know when to intervene. We can't really know when to intervene or when to maybe make referrals to another provider unless you see them on a regular basis so they can see what these trends might be and know when to do things. And remember, they care for you, but they also care about you. And so the closer that relationship is, and the more they understand you, not only as a patient, but as a person, they can better help manage your health care and make a greater difference in the long run. So briefly talking about stroke, again, this is something you can talk about for an hour by itself. This is the fast mnemonic that they use. F is for face, so if you have a droopy side of your face. A is for arms, it'll also go along with legs. So if you have a weakness on one side of your body where you can't lift your arm, you have loss of control of being able to hold a coffee cup or you're dropping things like that, you're having trouble walking because your leg is weak. Speech difficulty can be either you're mumbling words and nobody can understand you, you know the words you want but you can't get it out and you're having a hard time expressing yourself. And then the other one is essentially just saying to call somebody, i.e. 911, if you're having those symptoms. Other symptoms that you can think about would include like sudden loss of vision, sudden change in your mental status and your confusion that somebody else might pick up on. A lot of times you may make a phone call and you feel okay, but the person that you called can't understand you, can't understand what you're trying to say. And the reason that the time is up here is both with heart and with heart attacks and stroke, there's kind of a phrase that time is brain, time is heart, and I kind of think of it almost as a ripple effect. So if you throw a stone into a lake, throwing the stone itself is where the stroke starts. And the ripple effect is the brain tissue around it that gets affected from where the stroke started. And as you know, the longer you wait, the larger those ripples get and the bigger area those ripples take up. And so the goal is to intervene as early as possible so that you prevent that ripple effect and prevent damage to a greater area of your brain or your heart if it's a heart attack. And the sooner you can intervene, brain cells that have started to be effective, they have a better chance of getting back to their baseline and being normal versus dying and never returning. And so that's what the whole time is brain or time is heart thing refers to, is that as soon as you know that there is a possible issue, you should be calling 911 and getting to the local emergency department or medical center. This is sort of talking about heart attacks and some of the differences between men and women. There's the obvious ones are at the top, and it says even up there that chest pain is the most likely thing, both in men and women. But there can be nausea, there can be vomiting. The chest pain can spread to your shoulder, down your arm. It can spread into your neck or your jaw. And then in women, you can have shortness of breath. In women, they include things like fainting down here, indigestion. Those are in men as well. I think the thing is just remembering that it can be the symptoms can be very varied. So not everyone presents the same way. Chest pain is certainly the biggest one. Chest pain that radiates to the right areas is certainly concerning. But it can be just indigestion. You don't feel well, your stomach's kind of upset, your heart kind of lies low on the left side, and so it can give you that indigestion, stomach-like feeling. It can give you the nausea, which can be confused with indigestion. I had a patient who came in, it's been many, many years, but they complained of that their jaw hurt, and that they thought that their tooth was a problem. But when you delved into it more, asked them more specific questions, it really didn't seem like tooth pain made any sense. And so you get an EKG to look at the electrocardiogram of your heart and electrical activity in your heart, and they're having a heart attack. And that was their symptom, was jaw pain. It wasn't chest pain, it wasn't I can't breathe, it wasn't they're all sweaty and have the sort of the classic signs of a heart attack. And it's just a reminder to all of you guys that anytime you're concerned about something like that that seems a little bit off, I'd much rather you call your doctor or come to the emergency department and us say like, listen, that everything's okay and you're not having a heart attack, than not come and tomorrow find out that you should have come yesterday because it really was something concerning. And that's one of the more important things, and that's what this slide is trying to explain, is that kind of the bottom line is that whenever you yourself feel concerned about whatever symptom it is, you should be calling for help. Whether it's a friend to get you to the hospital, whether it's 911, whatever it is. The definition of a medical emergency isn't what I think as an emergency medicine physician an emergency is. It's what you think an emergency is. And it may not turn out to be an emergency after we've done a very thorough evaluation of all the things that could be. But that was what I was referring to just a few minutes ago, is that I'd much rather you come in and jump through some hoops and maybe feel a little bit of inconvenience for us to tell you that things look fantastic, rather than to wait, delay it, and find out that you should have come in the day that you started having symptoms. And that's what this is. If you feel it's an emergency, then yes, it's an emergency. And I don't care what it is. And whenever you come to the emergency department, that's the way we should treat you. We should treat you that however you come in, whatever your complaint is, to you, it was an emergency. Therefore, to us, it should feel like it was an emergency to you, and we should evaluate it appropriately. If you ever come to our emergency department and feel that we didn't address things as an emergency to you, one of the things on that first slide was up here, this part. So I need to know if you ever feel that you came in and we didn't do our job. You need to tell us that so we can do a better job to take care of you, to take care of the community, and to do the right thing for you. And so, like I showed you before, just call if you ever felt that way. I'm always happy to talk to anybody who feels that way, and as important as the medical staff and the medical center, for you to always feel that you're welcome to come for any reason whatsoever, and we're going to treat you in a respected way to address whatever concern that is, because to you, that was an emergency, and we need to deal with it, and we need to address it as though it is an emergency until proven otherwise. So, any questions that any of you guys might have for me? If not, thank you for coming, and I appreciate your time.
Thank you.
Thank you.
Thank you.